If they've got lower back pain because they're stressed or they've been sitting all day or they've been driving a lot, absolutely movement. Most lower back pain that isn't super serious will go away if you go for a bit of a walk. And there's so many different things that will cause lower back pain. It can be very, very hard to diagnose the true cause. But generally, if you've got lower back pain and it isn't something really kind of mechanically wrong, then absolutely go for a walk, go for a workout, but just listen to your body and just have a good warm up, do some mobility drills, see where you're at, maybe lower the volume, lower the weights or whatever it is you're doing for exercise, and just be sensible.
Welcome back to the Perform Well podcast. This is the podcast for you if you're looking for performance and wellness optimization so that you can not only smash your career, but also have a better life, better relationships, and better health. We believe that performance and wellness are yin and yang and work together. So listen in as we dive into topics that are going to help you optimize your life for the better. Hello, Adam Duncan. How are you doing, man?
Good. How are you?
Not too shabby, mate. Want to dive off today with a little bit of an easy question for you. What got you into being a sports massage therapist, mate?
So probably a number of things, really. I think I was always destined for this type of work. I was a fairly decent athlete growing up, played a good level of football, athletics as well. And that kind of led me to being pretty good at PE, and then the kind of natural thing of going to college and doing sports science. And just because of my kind of athletic abilities, I suppose. Couple of other factors. My dad is in the kind of medical branch of the Royal Navy, or he was. He's retired now. So I grew up with him knowing the kind of medical scene, the anatomy and physiology of the body, as opposed to cars and electric and plumbing and things like that. That's what he kind of gave me in terms of an education. And yes, that's probably where I'm at, really. It was very much just I was involved in sport heavily, came across physios and osteopaths and chiropractors through that, and then just my dad's influence really of that kind of medical scene growing up. And I remember going on board ship with him and meeting people who looked at blood for a living and other doctors and stuff, and it just very much kind of grew up in that mindset, really. I did my work experience in the hospital that he worked at within the the military, and heavily influenced by that world, really. So I think I was always destined to do something in sports healthcare, sports therapy, and it kind of goes in. Like, you could talk to me about biomechanics and no idea, but when I'm learning about the body or biomechanics or training or nutrition, for whatever reason, it seems to stick. So I pursued it.
Mate, that's awesome. I mean, me and Dan were obviously talking just before this. I was saying that I was a sports massage therapist level 3 myself. And I was like, when I heard your level 4, I was trying to think, what is the difference between level 3 and level 4?
It's quite a big step.
Is it?
So there's 3 levels. You've got level 3, which will teach you basic anatomy and physiology, although a little bit higher level than maybe some other professions. But in terms of a treatment point of view, you're not really allowed to touch anything that's an acute injury. And so it's very basic massage skills, understanding of the anatomy, and then you'll understand what an injury looks like and how to test for it, but you're then not really allowed to touch it. And so you would then work around that problem to help the client. When you then go into level 4 is where you can touch some injuries, but not all of them. You've got a lot more understanding of the intricacies anatomy-wise in joints. So a lot more origins and insertions of muscles, muscle fiber directions, actions of muscles, the different types of ligaments and connective tissues within a joint, to allow you to then work on certain injuries once they get to a certain stage. And then you have the level 5, which then takes that beyond that. You can work on injuries, a little bit more anatomy knowledge. You'll start to go off and do things like cupping and taping, and when they're suitable, and kind of take it through the different levels.
I didn't realize there were so many levels, because we were also talking about like PT side of things as well, and like it tends to go up to a level 4, but apparently there's a level 5 for PT now, which I don't personally know any level 5s. But Adam, on the sports front as well, what we wanted to delve into is obviously how long you've been working in the industry, because you've been in the industry for a while,
Yeah.
and we wanted to know, like, kind of, so how long have you been working with athletes, and what kind of sports do you tend to work with? Are you selective with sports, or do you tend to go for like kind of a wide range?
Yes, I've got my specialism, but I never turn anyone away. I've been in the industry a long time. So main background is sports science, performance coaching, personal training, strength and conditioning coaching, and then I started moving more into the therapy side of things um, a lot more recently. In terms of working with athletes, that really took off 3, 4 years ago. Um, I don't know whether that was just a right place, right time, or whether it was a reputational thing or what. Just developed my skills and my business grew. But had a couple of athletes come in. Southampton's great. There's some really high level athletes in Southampton. It's a fantastic city for some really good gyms, really good athletes here. But yeah, probably the last 3, 4 years in terms of high level professional athletes. A majority of my kind of specialism is in strength sports. So have strong man and woman, powerlifting, bodybuilding. I don't know if I attract that because of my size and the fact that I strength train, but a lot of strength sports. So I have rugby players that come to me. I sponsor a rugby player at the moment. I have some rowers, which might not necessarily ring true as a strength sport, but it is. It's a really powerful, strong sport, and rowers tend to be huge. And they just kind of go hard and hang on is the kind of thing in rowing.
Yeah.
So that's my specialism, is definitely those kind of power-based strength sports. But I've got tennis players, I've got professional triathletes. One of my clients, competes in triathlon for France. I've got climbers, footballers, all different types of sports. But from a specialism, it's definitely in those kind of strength sports.
Okay, so based on the fact that you obviously do rehab for all these different types of sports and people, what is the most common injury or issue that you have to deal with on a regular basis?
Yeah, so I see shoulders every single day. There's not a day that goes by that I don't see a shoulder issue, which is fairly broad when you think about the shoulder complex. That could be pec, it could be shoulder blade, it could be thoracic, it could be neck. But a lot of shoulder-based injuries in those strength sports, whether that's from lifting in the gym or whether that's just from kind of impacting things like rugby, followed closely by lower back issues. But I think with lower back, there's so many different causes for lower back that's just kind of the general populace. That's not specific to athletes. And I see a lot of knees in the summer because people go out running.
Yeah.
Guys up in the winter, but in the summer, people go, "Oh, I'm going to run," and high rocks and stuff like that's getting popular. So I'm seeing a lot more knees at the moment,
Really?
coming through, shin splints, ankle problems. We'll see how that is in the winter.
You should probably partner with Hyrox, mate. Extra businessman.
Yeah,
Go in.
yeah. I think the thing with high rocks and stuff like that is it's attracting people who are already fit and strong. And I'm seeing this summer, especially, I've seen a lot of shin splints this summer. And I think it's because people who are already capable are then going, I might go start running, or I might do the marathon, or I might do the Southampton half, or high rocks and things like that. And because they're capable of doing 10K, they'll go and run 10K. Doesn't mean you should. And so I'm seeing a lot of that kind of happens where people cross train, and as a result of their strength, endurance, ability, they then get injured in these new sports. That's
Well, it's like for me, I personally picked up running not too long ago, and I mean, I developed plantar fasciitis in my feet, and I was like, oh, brilliant, great, that's fantastic, and it is, as you're saying, there's so many people got into that high rocks background. I mean, it is very popular. I've spoken to a lot of people now that are doing high rocks as their outlet to say, I've done a high rocks event, but I think people are stepping into it sometimes without the actual full understanding of what's involved in. Like, you have to do an 8K run. I know it's split up, but you've got to be prepared to run 8K in between stations whilst you're doing it. And I mean, we've got a guy who went and competed at the World Championships as a mate of ours. Granted, nearly finished it. He got about, what was it, 40 wall balls away, and then
Yeah,
one of his kidney fails or something.
He was sixth from being the world champion in his age range, and he got kidney failure, 40 wobbles on the end.
Oh, wow.
Went to hospital and everything, and he had to spend a huge bill in France because obviously we're not part of the EU anymore. So, whew, incredible.
But, yeah, not good. There's nothing wrong with high rocks, by the way. People listening, it's great.
Yeah.
But if you want to get into it, treat it like anything else. Slowly build up your fitness, even if you are coming from a high level of something else. Don't not do it. I'm not trying to demonize that. So just be careful if you're already fit and capable when you cross train.
I'll tell you
what,
got
to be prepared.
I'll tell you what, a really, really, really good question in terms of low back pain, because you obviously mentioned it earlier about being almost the most common thing you deal with. Yeah. I've had a lot of clients in the past that will not turn up to sessions because they say, "Oh, my back hurts today, so I'm just going to take today off." In those instances, I know it can be quite dependent on context in a lot of cases, but what would you recommend those people when they say they've got back pain? Do you recommend they just don't do anything, or is there something that they can do to start helping the situation?
As you alluded to, it very much depends on why they have the lower back pain. If it's a mechanical issue such as a disc protrusion or a disc herniation, then maybe there needs to be a different approach. If they've got lower back pain because they're stressed or they've been sitting all day or they've been driving a lot, absolutely movement. Most lower back pain that isn't super serious will go away if you go for a bit of a walk. And there's so many different things that will cause lower back pain. It can be very, very hard to diagnose the true cause. But generally, if you've got lower back pain and it isn't something really kind of mechanically wrong, then absolutely go for a walk, go for a workout. But just listen to your body and just have a good warm up, do some mobility drills, see where you're at. Maybe lower the volume, lower the weights or whatever it is you're doing for exercise. And just be sensible, really. But movement and activity is, movement's medicine, motion is lotion, whatever cheesy phrase you want to throw on.
That's a phrase. Motion is lotion.
Motion is lotion. Yeah, absolutely. The body wants to move, and it has such a fantastic impact if you move in terms of getting blood flow, getting lymphatic flow, and that drainage, and getting from a recovery point of view, getting joints moving and getting that synovial fluid into a joint and opening that space up. So yeah, absolutely. If you've got lower back pain and you go for a 10-minute walk and it starts to subside, then you carry on. If it doesn't go away and you suspect there's other signs and symptoms and it could be something more sinister, then you may need a slightly different tact and you may need to go and get looked at and get diagnosed and get some advice. But yeah, general kind of, my back's a bit sore when you've had a long day at the office, go for a bit of a walk, see how you feel.
And judge it from there. I mean, if anyone's watching this, by the way, and don't know my story of how me and Adam met, Adam is my physio. So when I got my my herniation, Adam was the first point of call for me. And he helped me obviously go from not being able to walk properly or roll over on a bed to then being able to, get myself back into training. So obviously I owe a lot to Adam in terms of that side of things. He knows his stuff, just saying. And it's that kind of side of things, because I've spoken to a lot of people and I've noticed now as well, I always say, and you probably see it in my content, Adam, that I always say I'm not a specialist, go see a physio first, because that is the first port of call as a PT. I think a lot of PTs suddenly think they can work in rehab and they don't understand that they can't. There is so many complexities to an issue. You're saying shoulders. Shoulders are one of the most complex joint, if not the most complex joint that we have in the body, because there's so much going on there. So it's always port of call to go see a physio like yourself first and literally say, look, what's the issue? Can you help me diagnose this? And kind of, can we move forward from this? Now, talking about rehab, I kind of stemmed on it a little bit there. Have you got any amazing success stories that you can share with us from your, rehabbing sports professionals, everyday public, anything like that?
I think the best one I have to kind of let viewers know from a point of view of how to go about rehabbing is a gentleman, we won't use any names, I suppose, especially I haven't checked with him, but a fella come in to the gym. He's a powerlifter, a very good powerlifter, and he had a disc herniation. we actually had quite a few red flags for a serious condition that can occur as a result of disc herniation in the kind of lower back area. So first point of call was, I'm not too happy just yet. I sent him off to A&E. He didn't go. And then 3 days later, his partner saw the messages from me going, have you been to A&E? And told him off, and he went. So luckily, this condition is very, very rare. And I said to him that I'm really sorry. I'm probably wasting your time, but I'm not going to touch you until I know that it isn't this certain condition. He got admitted into inpatients because the doctors at A&E agreed. He had an MRI and we were all good. It wasn't this condition. So he came in and we started some rehab. And this guy went from me sending him to A&E to competing 9 months later at the British Powerlifting Championships, which is fantastic. And a lot of that work was him. But I think why that happened was his response to the advice. So two of the biggest challenges you get in my world is either getting people to do their rehab in the first place, which is either kind of time, or sometimes there's the thought process that it's my job to fix you. And there's not always that kind of ownership piece of going away and doing bits. Sometimes it can be because I'll offer rehab that looks really easy and really basic, and I'll ask someone maybe to do quarter squats. They can do full squats in the gym, and so they're like, well, why? And it's getting people to understand that I want you to do something very specific for a very specific reason. The other challenge, which I get with some of the professional athletes, is that they'll go and do their exercise, but they want to work too quickly and they want to push too much, and they're trying to get strong too quick, or get mobile too quick, or get back to sport too quick. Or they'll be like, look, I'm competing in 3 months. And I'll be like, oh, we'll see, you know. So they're the two challenges, is either getting people to do it in the first place or getting people to kind of hold back and be patient. This particular gentleman did exactly what he was asked to do, gave me regular feedback on how he was feeling so we could either back him off or push him on. He actually came to the gym just to do his rehab. He didn't do it at home. So from a mindset piece, he was like, no, I want to go to the gym. I want to be in that environment. I want to see my friends. So that psychosocial element, the psychosomatic element was still there. He wasn't stuck in his bedroom doing rehab, feeling sorry for himself. He was in this environment, being supported, seeing me regularly. And he just plugged away. As soon as something felt slightly off, because we all know your rehab's not going to go like that. It's going to go like that. Every time he had a little niggle or something kind of backtracked a bit, he came and saw me, and I was like, it's good. It's okay. Calm down. This is expected. It's all fine. Let's just take it back a step and let's go forwards. And I guess what I'm trying to say is he just did everything perfectly. The communication was fantastic. He made sure he was in the right environment. He still came to the gym, even though he was doing bird dogs instead of 300-kilo deadlifts, which would have been so hard psychologically for him, but he came and did it. And yeah, 9 months later, he competed at the British Powerlifting Championships after being sent to A&E, which is fantastic. Really, really nice story. And that wasn't me. That was him. That was his hard work and consistency. And same with yourself, Dan. I gave you advice. Other people gave you some advice, but we saw how hard you worked on getting better and educating yourself as well on what had happened to get better and help people in the future. And that's the key, really. So yeah, that was a real nice story. And that was only last year. That was very recent.
Man, that's awesome. What a story. What an absolute story. I mean, okay, so when it comes to obviously helping these elite athletes and powerlifters, and I know you mentioned that your advice was potentially he might not be able to compete in 3 months' time. I think that's the same guy we're talking about, right?
Just generally, I get that sometimes. Yeah.
Yeah. So obviously, in that instance, I totally get it. If someone's not in the best place to compete, it's probably best they not do. Mm-hmm. We recently went on a cycle. I don't know if Dan told you about this. Rob cycled 892 miles over 3.5 days. Yeah. And the pain he was in every day. I mean, obviously that's extreme endurance event. You're getting back pain, neck pain. I don't think he had knee pain, which is quite funny because he did before. In those instances where they are competing, it's an endurance event, you just got to get on with it. Like, what can we do to minimize the damage and the pain that the athlete goes through with their body?
Yeah, so you do see that a lot anyway. People come up to an event and they start the event training rather than the kind of normal programming that they would go through, which generally involves increased volume, increased load, sometimes event practices, especially in strongman. They'll do an event day to get the nutrition right and things like that. Um, a lot of it's just about managing that rehab and ensuring that they understand you're pushing yourself to compete at a high level, and so that increase in training that will require an increase in recovery. So whether that be nutrition, whether that be massage, whether that be stretching and mobility, whatever that might be, if you increase your training, your volume, your load, then you need to also think about increasing your rest, recovery, nutrition, and getting that side of things right, and to fuel your body to make sure it can deal with the demands you're giving it, and to listen to the body as well. I saw some really nice research that it was done in football, it was specific to a sport, but 78% of niggles termed as doesn't feel right, something felt tight, general kind of niggle as a buzzword. 78% of those that went untreated turned into an injury within 2 weeks. So that was very specific to football, and it was lower level football. It wasn't Premier League or anything like that, where I guess maybe they don't have the facilities for recovery as good as the Premier League. But it's a nice little stat to utilize, where if you're increasing your load, your volume for a particular event, look at the whole picture as well. And don't ignore niggles. Don't go, oh, bit tight today, and then crack on.
Yeah.
Let's think about that. Why is that tight? Does it just need a couple more days to relax? Can we train something different? Can we change the angles, the load, the volume? Yeah, just listen to your body.
Mate, it'd be great to get your view on this because obviously the extent of our rehab work for the cyclists, including myself, Dan, and Rob, was using a massage gun and basically just getting on a higher setting, put it into the muscle that hurts, and just going. So obviously the massage gun, the foam rollers. I don't know if it's necessarily trending at the moment, but it definitely was a few years back. People were all about foam rollers. How useful are those?
As a temporary solution, they can be useful. So massage gun utilizes percussion therapy, so you get those kind of vibrations through the muscle, and that causes a bit of a neural response, bit of relaxation. So they do work. Sometimes in the job, my lower back will start to get a bit sore on a long day, and I'll do the same thing. I'll grab the massage gun and ram it in there, and I get some temporary relief. But a lot of that just comes from that initial short-term touch, I suppose. You're not really stretching the tissues out or doing anything overly complex from a recovery point of view with that. It is very much sensory input, so you'll get the pain relief from the vibration and that neurological response that you get from that touch. Trigger point therapy, things like that. Putting it in where it hurts is a form of trigger therapy for yourself. So they are really useful, as long as you understand that they are a very short-term relief. So in the situation you guys were in, absolutely, I'd have been saying, yeah, ice, massage guns, tape, all that kind of temporary stuff, because you're in the thick of an event, and you're not going to stop. So just do what you need to do to get through, and then worry about it at the end. But I do advise, I've got massage guns here, I've got tape here, I've got ultrasound here, I've got little kind of focal vibration tools here. They are really, really useful. Very, very useful.
Apologies for interrupting the podcast. We know you're getting fully engrossed into this episode, and we really appreciate you stopping on the video on YouTube or on Spotify if you found us through one of the search pages. Make sure to leave a review and a subscription if you haven't already. But we just wanted to interject a point here that me and Nick have 15 years of coaching experience between us, and it's only getting better as we've got better guests on the podcast. The only way we can do that, though, is with the growth of our program that we've just released. We've got a 12-month Perform Well program, which has just dropped, and we'd love you guys to get involved in it. If you want to learn more details, make sure to head to the description, as we've got our website in there, which can give you a full overlay of the program. We're looking to help career-driven professionals, entrepreneurs, small business owners, and anyone dominate their life by improving their lifestyle. Me and Nick like to claim ourselves as experts in this area, and if you want to check out some of our other transformations, I'm sure you do. We've got some amazing people who have performed so well off the back of this program. Have a cracking day, and we really appreciate your time. Let's get back to the podcast.
Beautiful, man.
I agree with that, mate. And the thing is, with that kind of stuff, I do like to say to people, I'm like, if you are using massage guns and foam rolls, it's the same thing. Don't see this as like a long-term solution, because whatever's causing this level of tightness, you need to work on this area. There's clearly a reason that it is not feeling strong enough to deal with it. I think a lot of people, when Nick was saying it was trendy, I think a lot of people relied on that as a way of getting through sessions rather than just saying, okay, we do need to fix this issue. And actually it comes onto it, like how would you determine the difference between an acute injury and a chronic injury?
Yeah, so they're quite different, but sometimes they do overlap. So an acute injury would be a short-term instant flare-up. So a broken bone or an asthma attack or something like that, which are caused by trauma, injury, virus, infection. And they are things that will come quite quickly and will heal up quite quickly, whether that be through medication or manual therapy or rest and recovery. A chronic injury or condition would be something that comes on more slowly and potentially lasts forever. So that would be something like osteoarthritis, osteoporosis, where they'll develop over time. Sometimes they're even congenital and are genetic. And then once you have them, it's a case of managing and maintaining through medication, manual therapy, exercise, nutrition, to just deal with the condition that you have. So they're quite different from that point of view. Where they cross over and it gets a bit confusing is, I mentioned asthma. So asthma is a chronic condition in which you will have an asthma attack, which is an acute episode, if that makes sense. So
yes.
Yeah, that would be where they kind of cross over and it can get a little bit confusing. But acute, quick, short term; chronic, slow, long term. That's kind of it, really.
Yeah. I mean, you spoke earlier about obviously niggles turn into injuries, and I think we can all, tell the difference between what a niggle and an injury is to some degree. Like, it's those aches, isn't it? But when do you know there's a problem and that you should go to a sports massage therapist like yourself, as opposed to just give it some time, stretch it out, and do some training on it?
Yeah, so I get this quite a lot because the treatment that I'm in is inside a really busy gym. And generally what I'll say to people is, I get people come in, they've just finished a workout and they'll say, I've just hurt myself, as in right this second, and they panic and they come over. Normally what I say to people in that kind of situation is, don't worry, relax. You can tell when someone's really hurt themselves. Generally, if something doesn't go away within a week to 10 days, that's when I would start to advise that they go and see someone. So if something's just kind of tightened up or pulled or had a little tweak, even like a little grade 1 sprain or strain, generally that'll heal up in a week or two. And the body isn't fragile. The body does have its own kind of healing mechanisms and medicine cabinets, for want of a better phrase. And it will go about healing itself through an inflammatory response and doing what it does. So generally, if you're feeling tight and uncomfortable and there's a bit of discomfort or pain that lasts more than a week to 10 days, at that point, I would start to really think about, is there something going on here? Do I need to address this? As long as you are recovering and resting and not trying to push through pain, maybe if you've taken some medications, if some people don't like that, but if you've taken some paracetamol and it's worked, or if you've taken ibuprofen and it's worked, and possibly it's an inflammatory thing, that's normally when it's good to go and see someone. I think if anything is more sinister than that, so you're getting numbness, tingling, that kind of paresthesia, if you're getting any kind of weakness in terms of you can't use your arms, you can't grip, you can't lift a cup of tea or coffee, or getting in and out of a car is difficult, again, that sounds like you would probably want to go and see someone sooner than that. And when I mean weakness, I mean getting out of a car and having some pain in the hip. Okay, not ideal. You shouldn't be in pain. But if you physically can't do it because there's a loss of strength, I would go and see someone much, much sooner. But if it's a bit sore, it's a bit achy, feels tight, give it a week or so. If it's sharp shooting pains, real deep burning pains, you've got a loss of strength, tingling, numbness, then see someone a bit sooner.
What I was going to ask in there, Adam, as well, you kind of highlighted, obviously, these kind of symptoms that people will feel throughout this point in time. And we did speak a little bit on the case of people coming to the door from the gym when they're in pain and in injury. So what, for yourself, we spoke really positively about a success story, but what is one big horror injury that you've had to deal with? Maybe that's come off the gym floor to yourself, or one that's come through like your website or something and booked in?
Yeah, I've seen quite a few like ruptures to Achilles tendons. I've seen that go on a football pitch.
That's the worst.
It's horrible, absolutely horrible. The issue with full ruptures is generally they come with no pain because they're ruptured. There's no tension anymore. The proprioceptive nerves have been not working because there's nothing attached anymore. So you'll see someone with like a bicep tear or a pec tear or an Achilles rupture, and they're not in pain. So that one that I said about the Achilles on the football pitch, the guy, I was working side, pitch side, and the guy took the ball, turned, wasn't tackled, there's no one near him, and he just hit the sack straight on the floor. It was like, what's going on? We heard that pop, that kind of telltale noise where everyone around goes, what was that? But he got up, started walking around, and I put him in his car, said to him, look, you need to go to A&E, you've ruptured your Achilles. And then half an hour later, he was still sat in the car. He was waiting for his wife to come. So I went over, I was like, how you doing? Is everything all right? He goes, yeah, I'm not in any pain though. I think I'm just going to go home. I was like, no. You need to go to A&E. You've ruptured your Achilles. And it's things like that. They're the worst ones where if something's fully ruptured, it quite often doesn't come with any pain. You'll get some swelling and stuff, which will cause discomfort. But people like that guy with the Achilles, he was walking around. And it was like, I think I can drive. And I was just like, no, your foot's moving because there's lots of other muscles. It's not just one that's now not going to work. It's not going to kind of flop about. And it's just trying to convince people to take it seriously. They're the worst ones. And it's not until days later where the swelling and the bruising comes out. He messaged me about 3 days later. I was like, yeah, I'm having surgery. I was like, yeah. So that can be good fun. I've seen on the gym floor, pecs go, bicep tendons rupture. I've got a guy at the moment who I am rehabbing. He had 3 out of the 4 quadricep muscles tear off the bone.
Oh, what?
Yeah, nice,
Whoa.
nasty.
Oh,
So, surgically
that sounds like Callum von Moga, the guy. Have you followed his rehab story?
Yeah, he's had quite a few different bits go.
He had his entire quadricep rip off and his bicep when he fell off the edge of a cliff, didn't he?
Yes, yeah, he was rock climbing. Yeah, not nice. But
terrifying.
They're definitely the worst one.
Would you say though that like those kind of, I'm not saying obviously the Achilles tendon because I'm not saying a footballer's going to be on steroids, but obviously steroids have been known to increase the rate of muscle building and cause tendons to become stiffer.
Yeah.
So a lot of those injuries that you saw, are they from steroid users, or is that generally just because of poor training, poor periodization?
So the Achilles wasn't. Achilles was a footballer, and it just went. Yeah. And just one of those things. The other injuries, those people are using performance enhancers. Now the steroids and the drugs won't have caused it. but what happens is the muscular development is rapid as a result of the conditions that they're in with the increased testosterone, those anabolics. Generally, people using those substances will be eating more and training more. Your recovery improves from the substances, and so there's less pain. You can push harder. You can push for longer. You can do more sessions. That increased musculature and strength is great, but tendons don't develop at the rate muscle does. Ligaments don't develop and strengthen at the rate muscle does, especially where there's external factors influencing hypertrophy. And that's where the problems come from, is that a muscle will get really, really strong. You are more capable in terms of your physiology within your body to lift more for longer, more frequently, and the tendons can't keep up. And that tends to injuries and niggles. Some of those drugs are known for drying you out. Some of them are used for competitive purposes when you're dieting down for stage or whatever that might be. So they are known to dry you out, and then that lack of fluid and hydration can lead to types of injuries.
No.
Well, what I wanted to go down a little bit as well, Adam, is like, it's good you've highlighted obviously the use of, we've got the steroid usage within the industry, and I think that highlights for a lot of people when you're in the gym and comparing how you're looking and how you're training. You can't compare to everyone because you just never know where people are at, so you've got to kind of go down your own path. Yeah. But I get a lot of people message me about this as well, is about muscle imbalances. It's one of the most common things I hear is where people go, oh, my right arm's not as strong as my left arm. What should I do? Yeah. So actually, from your perspective, I want to get your say on this. What would you advise people to do have got muscle imbalances and poor biomechanics?
So it depends really on whether it's causing you an issue. So nobody's symmetrical. We will have dominant sides, so you might find that you've got better grip in the right hand than you do in the left hand. You might find that you favor a certain leg, whether that's in sport or just generally in your gait and life. So if you have what I would call like a natural imbalance, and you're not in pain, and you're managing to work and do your job and go to the gym, and you can go home and play with your kid or whatever it might be, don't worry about it. I get a lot of people coming in and being like, oh, I'm really like lopsided, and so am I. Are you in any pain? No? Cool, don't worry about it, it's all good. You're not fragile, we're not symmetrical, don't worry. However, if you are in front of somebody like myself because you are in pain, then absolutely posture and mechanics and imbalances will start to become a factor. Maybe it's not so much as the cause of injury. I'm not on that kind of boat where I think posture causes injury. I don't really care about your posture, but it can become a maintaining factor of the injury. So you might have like an anterior tilt in the pelvis. So what? Bit more lordotic than anybody else. Don't care. However, if you've then strained your hip flexors and your anterior tilted in the pelvis, and those hip flexors are in a kind of non-optimal, hate that word, but let's use it, non-optimal position, then the posture will maintain the problem. And that's where the biomechanics then starts to come in. Whereas to use that example, if you've got a sort of forward tilted pelvis, the psoas and the iliacus, which are hip flexors, are not in a great position. The hamstrings are then lengthened, so they're not in a great position. You'll have shortened lumbar, your lower back muscles will be fairly shortened. Because the hamstrings are lengthened, the gastroc, which crosses the joint, might be under strain because it's trying to do the job of the hamstrings a little bit around that knee. That will then cause torsion in the knee. That changes the foot mechanics. And if your foot mechanics aren't quite right, you'll then get issues coming up the front of the shin or in the foot itself. That'll cause more torsion in the knee. You'll get patella maltracking, which then can cause you quad and knee problems. And then we're back up at the pelvis. And so things will, and that's not even coming upwards. Rectus abdominis, your six-pack muscles, they'll be put on stretch. There's 4 layers of abdominals, so what's that doing? They attach to the ribs, so what's that doing to the ribs? How's your breathing? How's your diaphragm? We can go on and on and on.
Yeah, mate, we haven't even started talking about leg length discrepancy yet.
Yeah, Yeah, 100%. So if you're right side, then you might have a leg length. Absolutely. If you're not in pain, don't worry about having wonky legs. So what? But if you are, it becomes a factor to look at. Um, so biomechanics are really, really important. Muscle imbalances are important. If anyone's interested, look up force coupling and look at how muscles work together in order to move the shoulder blade or whatever it might be in a joint. Um, to rectify that, it's about understanding where it's coming from. So, is it an injury? Is it due to form or your sport or your job causing a functional imbalance? And therefore, how is our joints moving? How are things working together? What muscles need to be strengthened? What muscles or joints might benefit from some mobility work?
Mm.
And just to look at why this is happening. Is it the job? Is it training, form? Actually, is it the equipment you're using in your sport or your job? Is that correct and appropriate for you? Or if you've gone on a long bike ride and you've borrowed someone's bike, might not be suitable to you. Offices are really bad for that, whereas everybody in an office, if you walk into a commercial office, all the desks are the same, all the chairs are the same, but you've got 6'4" guy here, 4'11" guy there. They've got the same desk setup. So it's about understanding what your body's doing, why it's doing it, and then looking at, okay, what do I need to strengthen? What do I need to mobilize, stretch, whatever? And it's complicated and it takes time, and that's where it's worth, if you are, especially if you're getting pains and niggles and problems, seeing a good PT or seeing somebody in my kind of world in terms of manual therapy, sports therapy, to help you with that journey. Because biomechanics and kind of body lesions, it's messy.
Yeah, mate. And to be honest with you, like one of the best advice I say to every single client I ever train at the beginning, I say to them, at some point you're going to get some niggle or maybe even some injury, and like it's completely normal because you're not going to be able to, figure out everything that's going to happen to someone before it happens.
Right.
But I have had clients that are very injury susceptible compared to others. I've had clients which they get the odd niggle and it's fine, and I get some clients that literally every single week they got a new injury, and we're just rehabbing the same thing. But why does that happen? Why do some people get so susceptible to injuries and some don't?
It could be genetic. It could be that you've got people who are more capable of sports. They've got better proprioception, hand-eye coordination's better. Speed up, especially in kind of youth. Some kids are great at football as soon as you give them one. Some kids ain't. So I think sometimes it's about just that natural ability. It could be that somebody's got really good hormone balances, or somebody's not got good hormone balances from a recovery point of view, from strength point of view. It could be lifestyle factors. It could be some people are inactive in their roles at work, or have poor nutrition, poor sleep, higher stress for whatever reason. It could be, people smoke, some people drink. Hydration. A lot of people rely on coffee and Coke and maybe just have 1 liter of water. Some people drink 4 or 5 liters of water with electrolytes and multivitamins and all that kind of stuff. So there's lifestyle factors, and there's this kind of genetic, general, congenital. Some people are naturally athletic, some people are not. And then I think also it could come down to, I've seen people with shoulder injuries because they're really kyphotic, they're really kind of hunched over, and they've never had any problems up until their 40s. So again, posture is not the problem, but they've gone into a gym in a fixed machine that's built for the average person, whatever that is, and all of a sudden they've gone from this to this. Body doesn't want to do it. It's the wrong position for them, and so you then are predisposed to some injuries, and that tends to happen. So lots of different reasons, really.
Also, we touched on like obviously your job coming through as a sports therapist. We just want to touch on this before we round this off.
Yeah.
But what would you say is the most rewarding part of being a sports therapist?
Yeah, I'm going to be super cheesy here, and I apologize.
Go on.
But it is honestly helping people. If you get into this industry and your industry, guys, as personal trainers, whether you're in healthcare, medicine, if you're in this industry for any other reason than you like helping people, might not be the best industry for you. There are other benefits and other things that are great in terms of our own training, nutrition, financial rewards, so on and so forth. But the best thing is helping people, seeing people who are in pain and then are not in pain because you've been able to help them and educate them and do some work with your hands or in the gym is so rewarding. And also seeing people from a performance point of view who maybe aren't in pain but use you for recovery or performance management or strength coaching, and then they go and hit a PB, whether that's at Park Run on a Saturday or whether that's at the World Championships and they're competing on an international level. Like, being part of the team that's involved in that, even if it's a small part, that can be really, really cool and really rewarding. I like both sides of that.
You know, I agree, mate. I've had people come through my ranks as well. As I say, on like the sciatica front, I haven't had anything, you know, to the degree that I had it, but I've had people genuinely come through and they've mentioned, I mean, we've been cross-pollinated, haven't we? Like, I've got clients of mine who are also clients of yours, and they've come back saying they're pain-free. So, you know, that's a win for both of us at the end of the day. It's that team effort to get it. And I love the fact that in the industry, you can work with so many different disciplines as well to kind of help people get the end result, because at the end of the day, that's what we're all in the industry to do. As much as our marketing is, you know, directed to a certain focus or certain niche, we're trying to bring in these people for whatever. At the end of the day, the whole foundation of the fitness industry is just to help people. And if we can do that by working together, well, it's a match made in heaven, really.
Mate, the amount of miscommunication out there as well. Like, they need people that are educated and actually want to help people. There's too many fuckers out there.
It's so important that you work in teams. I send people to other physios who are better at what I do at a certain thing. I send people to osteopaths, chiropractors. I work with lots of different PTs. It's so important to work as a team. The client comes first. And if the client comes first, the client gets better, the patient gets better, then you'll reap the rewards of that long term. But yes, so I love working in teams, you know, working with PTs and getting people out on the gym floor or referring to other practitioners where needed. It's so important.
100%.
Well, we love having you, Adam. Absolute boss, mate. And when I've got any clients that get injuries, I'll send them your way as well, now that I know this. So,
very much.
Yeah, good man.
What we'll do then, we'll round off there. We appreciate you coming on, Adam, but we're just going to do our little spiel towards the end. So the last thing that we need to ask yourself is, obviously, at the end of the podcast, one of the big things we do is we plug the people that come on. So where can people find you? Where can people get on your services? And where can people get your help?
Yeah, sure. So the best place to see me and see content is on Instagram, which is Magni SMT. Or if you want to just come and see me directly, then I do have a website, which is www.magni-smt.co.uk. If you Google it, it'll come up. But yeah, if you just want to chat, see some content on Instagram, if you want to come and see me, book an appointment, I do have a website that you can find.
Awesome. Thank you very much. Well, guys, thank you so much for listening today, and thank you, Adam, for coming on. Make sure you follow, make sure you leave us 5 stars, and make sure you subscribe. If you haven't already, we're nearly 100 subs, which is absolutely amazing for the podcast. We're looking to continue growing. We're looking to get more guests on as well. So stay tuned, and we'll catch you guys later.
Ciao.